Hi, welcome to Radiography News Ghana. Today I want to take you through what you not be taught in school. So we have law of isometry. I hope you have not heard it before. I think this will be the first time you are hearing it. So I think it might be very beneficial to you. And we are coming to deal with imaging long bones. So what we have here is long bones. And bones in our body by classifications of shapes. We have long bones, short bones, flat bones, sesame bones, and irregular bones. And these long bones you are talking about, as you see on this screen, is that we have the femur, we have the tibia, fibula, we have the humerus, we have the radius and the ulna. And when you are imaging long bones, you know that for you to get a very less distortion amount in your image and also optimal anatomical alignment, you have to make sure that the part you're imaging uh, is parallel with the IR and also the CR is perpendicular to the image body part you are doing. So that you get the ideal one. But when you look at the B here on the screen, you see that the body part is off-centered. And when we look at the C2, we see that the CR is angulated, but the IR is just parallel to the body parts. And when we look at the D, the the image receptor is slightly inclined, but the body part and the CR is perpendicular to each other. And when we look at the E2, the CR and the IR is perpendicular to each other, but not the body parts. All this aside the A will cause an image distortion. But we concentrate on the D, what we call the foreshortening. And the foreshortening is that it's a shape distortion and it's demonstrating one of the structures axis appear shorter on the projection than the opposite axis. And this occurs because the IR and the ER are perpendicular to each other, but the body part is inclined. And the greater the inclined, the greater the foreshortening. So when we look at the image here, this is the humerus, this is the proximal, and this the distal part. So when you look at this part, you see that this part is a little bit the same though, but here has been foreshortening, and some parts looks as if it has been cut off. So this is the foreshortening we are talking about. And we normally see some of these things maybe in case of trauma cases and at times where the patient cannot bend their arm or fully extend their elbow, you get some of these things. So when imaging a long bone where the patient is unable to position the bone so its long axis is parallel with the IR and the alignment created between the IR, the CR, and the bones determine the degree and the type of distortion and anatomical relation demonstrated on the resulting projection. So for instance, let's say we have what we call the image receptor here. Then we have body parts on this one. So it means that the degree created far away, the body part far away from the image receptor will give you certain type of distortion. And the one we are looking here is the foreshortening. So it means one part will be longer than the other and one part will be shortening. So here you see that this part is closer, it's normal, but this part it has increased in OID. So maybe it's a certain type of degree, let's say 30. So this type of distortion, you have to correct it. And this one brings us to the law of isometry. So it says that The IR should be set at half of the angle formed between the object and the IR to minimize the foreshortening. So with that, we have 20 here. So if the half of it is 10, so it's this 10 that you have to angulate the CR so that you get to minimize the foreshortening. So when we have something like this, that is what we do. So the law of isometry demonstrates the least foreshortening. It minimizes it so that you get a very best image. So for instance, maybe you're having a patient doing a femur and the person cannot fully extend the knee, and it has created an image like, let's say this is the femur here. Forget, let's say, forget about the thing. Just look at the shape that I've drawn. This is the femur and this is the image receptor. And maybe there's certain kind of degree that has been created here. So let's say 30. So let's say this is 30. So with this 30, half of it is what? 15. So with this 15, that is how you angulate the center at the mid shaft of the femur so that you cover both joints. So what you have to do is, if you cannot cover, just make sure that the area of interest uh, is achieved. So we have so you angulate towards the proximal side. So angulate towards this side, 15, 15 degrees, 15 degrees towards this side. So with this, you know that you are fully covered, and you make sure that the image will have less foreshortening. So if you find this beneficial, make sure you subscribe and share so that your other colleagues too have an access to this insight information. If this is the first time you are hearing this, please comment below in the comment section and let's have a discussion. You can leave some commendations too and it will help. Thank you very much. Bye bye.